Hello everyone, I am Dr. Paridhi Agrawal. Welcome to Dental Mate. Today in this video, we'll be talking about a major topic of concern, COVID-19, which can be a probable question in your upcoming exams. So let's get started. So if you remember, it was in 2002, there was an outbreak called as Severe Acute Respiratory Distress Syndrome or SARS. Back then, it was believed that SARS hopped from a bat. From the bat, it mutated and infected the intermediate host, believed to be a civet, and then it mutated enough to infect the humans. But their effect was quite benign with a fatality rate of about 11%, and it caused mild symptoms like viral rhinitis, viral pharyngitis, viral laryngitis, but rarely SARS. After that, within a decade, that is in 2012, the virus mutated enough in its animal reservoir and got transmitted to camel, which was its intermediate host, and then to humans. This was the MERS virus or the Middle Eastern Respiratory Distress Syndrome virus. Now, this virus had a fatality rate of about 34%. Both of these viruses belonged to the coronavirus group. Now, what actually is coronavirus? If we look at the 3D structure of coronavirus, it is found that it contains crown-like spike proteins, and hence it is named corona, which means in Latin crown. The coronavirus family has numerous viruses, but only 7 of them can affect human. Out of these 7, 4 strains are not much dangerous, but 3 strains, that is the SARS, MERS, and the SARS-CoV-2, the newly discovered strain, which these 3 can cause fatal complications. Now, the COVID-19 or the coronavirus disease 2019 is caused by the SARS-CoV-2 virus, which is the Severe Acute Respiratory Syndrome coronavirus 2. This is a positive single-strand RNA virus. Now, in the coming videos, we'll be seeing what benefit this virus has, being positive single-stranded RNA virus. So, in 2019, the SARS-CoV-2 virus transmitted from bat to its intermediate host, which is believed to be pangolin, and from the pangolin it mutated and infected human hosts. Let us now discuss about the epidemiology of the disease, how it started and then how it spread all over the world. So, on 1st December 2019, patients reported to the hospital of Wuhan, Hubei province, China, with clinical symptoms of dry cough and pneumonia, but there were no etiology known for the same. Since then, there were clusters of cases with same symptoms. So, on 31st December 2019, the cases were reported to the WHO country office as PUE, that is, pneumonia of unknown etiology. After studying all the cases, it was found that most of these people in the lot visited the seafood market of Wuhan. So, it was on 1st January 2020 that the seafood market of Wuhan was closed. Then, it was on 7th January 2020 that WHO declared the coronavirus as novel or new coronavirus. Okay? Then on 9th January 2020, first death due to coronavirus took place in China. Thereafter, the virus started spreading globally. It was on 13th January 2020 that the first case was reported in Thailand. On 30th January, 2 things had happened. India reported its first case, and on this day, WHO labeled this disease as public health emergency of international concern. It was on 5th February 2020 that WHO admitted there is no known effective treatment for the disease. On 11th February 2020, novel coronavirus was called COVID-19 by WHO. 1 month later, on 11th March 2020, WHO officially declared COVID-19 as pandemic. Since then, the cases of COVID-19 have been increasing and countries are experiencing second and third waves of the disease. A ray of hope was seen on 8th December 2020 in the world and 16th January 2021 in India when the vaccines came into use. Since then, a large group of people are being vaccinated against the COVID-19 disease. So I hope it is now clear to you all how this virus spread in the country. In the coming videos, we'll be discussing its virology, pathogenesis, symptoms, and many other things. So stay tuned, keep visiting. Thank you.